now.
Hi, everybody. My name is Kim Williams. I'm an MSW practicum student here at SafeLink, Alberta, and I'm going to be sort of facilitating this Safer Barebacking Knowledge Thirsty Thursday event. Chris and I are in the same room at the moment. He's right there. And so we're going to hopefully be able to remember to mute each other and ourselves when one of us is talking. So welcome. And this is the first time I've ever facilitated anything with SafeLink. So bear with me, please. So we'll first do just some introductions and housekeeping. So again, my name's Kim Williams, pronouns she, her, and practicum student here at SafeLink. And I also want to just mention that, we come here together today in the traditional territories and the current homelands of Treaty 7 nations, which include the Blackfoot Confederacy, the Ahinakota Nations, and Tsuut'ina Nation, as well as Métis Nation of Alberta Region 3. And for me, a land acknowledgement can so easily be quite performative, but I like to always remind folks that, I'm on a constant journey of, as a white settler to this land, I'm on a constant journey to sort of unlearn some of the settler colonial lessons that I learned quite early on in my entire life. So, and I feel like a presentation like this, and having learned a little bit about a community that I'm not clearly part of at the moment, and we'll talk about why I've made that statement in a minute. Having this whole process of putting this presentation together and facilitating it, and kind of moderating a discussion, hopefully between you all and Chris, we will sort of engage in this decolonization process together. So, Chris, if you'd flip my slide, please, that would be delightful. So we'll just do a bit of housekeeping. And one thing is, just please be forgiving of technology. We all, I think, are so used to, at this point, doing the Zoom thing that we kind of know the drill. And then please mute when you're not speaking, but please, please, please feel free to unmute and ask questions anytime. Our Thursday events are brand new this winter, and they're only 45 minutes, so we can't tackle everything. But if you feel like you want to interject, or you have a question or a comment, or something that we don't, please feel free to just jump on in and ask questions anytime. And then take what you need, okay, to take care of yourself. If you need to stand, if you need to stretch, if you want to pace, if you want to step away, whatever you need to do to take care of yourself is what we really encourage here at SafeLink. And again, you can ask questions verbally by unmuting and shouting them out, or in the chat box. And Chris will be monitoring the chat box for me until I hand it over to him. And then I'll monitor it for him. Oh, Chris, did you want to introduce yourself as well? I kind of blew right on past that, didn't I?
Hi, everyone. My name is Chris McBain. I'm an education coordinator here at SafeLink, Alberta, and I get to work with Kim, and I'm very excited about the presentation today.
Yiffy Skippy, thank you. And you're invited to turn your cameras on, of course, if you'd like, but you're also welcome to leave them off as you need. And then just the last little bit of housekeeping here is just a bit of a trigger warning. There may well be context in our conversation today that could be triggering to you. So if you do find yourself having a response, either during the conversation or even after it, we really encourage you to step away, engage in self-care, talk to someone you know and trust. This could be a friend, a family, a coworker, or a professional. Call the distress center, and that phone number is right here. And then obviously, if you do require urgent help, call 911. And we'll stay online just a bit afterwards, just in case anybody wants an additional debrief. And so let's talk a little bit about the agenda for today. Again, we just have 45 minutes, so we can't hit all of the things, but obviously, in terms of safer barebacking, I think it's important for us to really define it. So we'll think about what is barebacking. And we're going to talk about some raw facts and cultural context. And yes, that pun is intended. And we're also going to talk about how can we best support the community that engages in barebacking. And then we'll talk as part of that conversation about some harm reduction strategies for safer barebacking. And that some is in parentheses because you all might have some ideas as well. And this is what we're really hoping to do, is just generate some strategies and some conversation and some ideas about how best to support this community. So let's talk about what is barebacking, some raw facts and some cultural context. And Chris, you can go ahead. Yeah, there we go. And so we're going to have a little fun today. And obviously the horse is an example of that. So barebacking is, in its very fundamental form, an intentional, unprotected anal intercourse. So it comes from the equestrian term, and hence our little horse here, barebacking, which is the practice of riding a horse without a saddle. And it's important to know that the term barebacking may not be acknowledged by all the folks who practice the behavior. So some men use the term raw or natural instead. And then one thing to kind of go back to what is barebacking, I want to also talk about who engages in the practice. And so this is really a slang term that's used in the LGBTQ plus community to refer to intentional unprotected sex, but particularly anal intercourse, and particularly among cis men who have sex with other cis men. So we're really talking about the gay community, particularly cis men who are having sex with other cis men. And this is why some men use the terms raw or natural instead. Just go ahead and flip my slide for me. So again, back to these sort of demographics. And again, we're really focusing about the cultural context and kind of just some basic facts about this practice. This practice of barebacking became widespread in the LGBTQ plus community in the 1990s. And it was particularly because HIV positive men who have sex with men began openly discussing having sex with other HIV positive people without using a condom. It was, again, most common among cisgender men in the global north who do have sex with men. So in other words, and this is really important for our conversation today, we're talking about a specific group of people who were generally socioeconomically advantaged, of white European descent and or from a Christian cultural context. So this is a very sort of settler colonial practice. You can flip my slide, please. So why does this matter? And for whom? This is an opportunity to get us thinking intersectionally, right? So which men are engaged in this practice? Some of these demographic information is important for that question. And then under what circumstances are they most likely to engage in this practice and why? And who is most likely in a position to benefit from barebacking and who isn't? So these questions get at why this topic matter, and we're going to talk about that in the next set of slides. So let's talk about some history and cultural context, and this is really just a quick down and dirty timeline, right? So in the 1980s, there was the AIDS crisis, and condom use was promoted as a public health measure to prevent HIV transmission. Then in the mid-1990s to 2000s, there was the quote-unquote safer sex health campaigns that really established condom use as the norm for sex between men. And then in the 2000s, there was huge progress in HIV prevention and treatment. And so the fear of transmission of HIV was dramatically reduced. And just sort of an important piece of this in a Canadian context, Health Canada approved a drug called PrEP, which we'll get to in a few minutes, in 2016. And so by 2021, just 5 years later, rates of new HIV infections actually went down by 21% because of the advent of this drug called PrEP. And then we get to the present day, right? So more people are living with HIV because treatment's available and it's increasingly accessible. And so less people are dying from AIDS. Like lots of HIV never actually progresses to AIDS because of treatment as prevention and these drugs that have been invented. But the problem is that condom use is down. And so as a consequence, rates of STIs, including HIV, have actually increased. You could flip my slide, Chris. Thank you. So let's really unpack this a bit, right? So in the mid-1990s and 2000s, this was when safer sex public health campaigns were established and condom use became the norm for sex between men. And the but is a big one. So early gay stream media references, and this, when I talk about gay stream media, I'm talking about things like The Advocate, Genre Magazine, and others that are specifically meant for the gay community. These magazines, they expressed a concern for HIV prevention as part of these public health efforts. They generally advocated barebacking only in the context of sex between people of the same HIV status. Now, as a way of kind of reclaiming their agency in the decade after the AIDS crisis, some HIV positive men refused condom use with other HIV positive men, because there was no risk of transmission. So they were really sort of in a quite kind of agential way rejecting the public health campaigns on condom use. And they also advocated or argued that it was a way to feel closer and more emotionally intimate with their sexual partners, particularly within a society that was really stigmatizing them and continued to do so throughout the 90s and 2000s. And the problem, though, that folks sort of started to identify is that the practice of barebacking quickly gained popularity among HIV negative men who have sex with men. And so the consequence was that there was sort of this moral panic that ensued, and it was so pronounced that barebacking came to be seen as this sort of rebellious and transgressive erotic practice that mainstream media, so sort of not queer identified, not specifically for gay or men who have sex with men, but mainstream media started basically having a moral panic around making sort of stereotypical and quite stigmatizing assumptions that HIV positive folks were just, willy-nilly spreading HIV to the rest of the population because of this barebacking practice. Obviously, that was not what was going on, but this is what ended up being spun. Chris, you could flip my slide, please. So then we move to the 2010s, right? And this is the decade in which there was a huge progress in HIV prevention and treatment. And so as a consequence, fear of transmission has really reduced quite dramatically. As sort of, I think, is obvious from what I'm talking about, really around the problem around barebacking was the concern around HIV transmission. And so because all of this kind of has reduced the fear of transmission dramatically, there's maybe less concern that barebacking might be risky, but we'll get to that in a second. So there are 4 sort of conversations that are related here, right? So there's TASP. So this is treatment as prevention. This is basically consistent antiretroviral treatment to prevent forward transmission of the virus. So in other words, treatment as prevention, if you are on treatment, and it's consistent, you're not able to transmit HIV to your sexual partner or to anyone, really. PEP is post-exposure prophylaxis. So that sounds exactly what it is exactly what it sounds like. So it's taken after the potential exposure to HIV, and there are particular rules around PEP. So it has to be taken within 72 hours of the exposure, and then every day for 4 weeks, and then you stop. This is different than PrEP, which is pre-exposure prophylaxis, which is an HIV prevention method for people who don't have HIV, but who want to reduce their risk of becoming infected with the virus. This is a once daily pill. It's used consistently and is shown to be very effective at preventing HIV transmission. So essentially, U equals U. Undetectable equals untransmittable. Chris, flip my slide, please. So Let's come to the present day, or why does all this matter? Why are we having this conversation about safer barebacking when the risk of HIV transmission seems to be pretty low, assuming that you're on treatment as prevention? And more people than ever before are living with HIV, but here are some problems. Because, first of all, 1 in 7 Canadians living with HRV are not aware of their status. And so as a consequence, it's very well possible that they could unwittingly transmit HIV and other STIs to their sexual partners without knowing it if they're not using condoms or engaging in other safer barebacking practices. And barebacking is very popular in the men who have sex with men community. So, and it's HIV positive men who have sex with men that are more likely to have bareback sex for all the reasons I sort of outlined just a few minutes ago. And barebacking experiences are very easily found online, you know, via online forums and at themed sex parties. And so one of the things that folks seem to be noticing is that the resurgence of barebacking in this community seems to have led to an increase in STIs among the MSM community. There's not a direct correlation as yet in the research, but this is what scientists and social scientists are sort of kind of finding. There is a higher risk of acquiring HIV from bareback sex than other types of sex. Largely, this has to do with physiological reasons, mucous membranes, and easy transmission. And also, if you're not engaging in safer sex practices generally, there is a higher risk. And bareback sex can lead to other types of STIs. And this is really, really important to remember, right? That anytime you're not engaging in safer sex practices, generally, it's not really only about HIV transmission, but can be about other STIs, sexually transmitted infections more broadly. And research has confirmed that condom use is down, but as I mentioned earlier, rates of STIs, including HIV, have increased. And this is very, very prevalent in men from visible minority groups. They're much more likely than white men to use condoms. And so what's really interesting here is that when we think about who is more likely to engage in quote unquote risky barebacking behaviors, it's really white men who are less likely to use condoms than men from visible minority groups. And just to sort of lay this out in the context of our own clients here at SafeLink, there was a study done with regard to our own clients. And I'm just trying to find, my notes are giving me a hard time here.
Want me to speak to it?
Yeah, can you speak to it, Chris? Thank you.
So we did community-based research around the topic of chemsex, sexualized drug use, and we interviewed about 43 different people, and we asked them a whole host of questions. And among them was rates of condom use, just because we understand that there are statistics that indicate that persons who engage in chemsex regularly within a year tend to seroconvert, 35%, I think. So it's quite a higher propensity. So we asked about condom use. 46% said they never use condoms. 5% said rarely. 3% said almost always, and 28% said occasionally. And whenever we're thinking about sort of analyzing this data, one of the questions that we kind of have to think about is, are people giving answers that the interviewer might want to hear, right? But you know, one thing that we can say for sure is that that a large portion of the people that we interviewed don't use condoms regularly. Only 18% said always. And so, and these numbers are kind of reflective of other studies that have been done. So they're congruent with the findings that we have.
Thank you so much, Chris. Yeah, Chris was the one who did all that interviewing. So he knows that stuff way better than I do anyway. So that was fortuitous that my notes wouldn't work just at that moment. And so have another click, Chris, because barebacking remains risky. And so this is important, right? And as we've sort of outlined, there are really quite strategic, political, and personal reasons why folks engage in barebacking. But it's important to think about the fact that just because it may well be among this community that the risk of HIV transmission is low, that doesn't necessarily mean that there's not other kinds of vulnerabilities that can happen with when engaged in this practice. So now, go ahead and flip the slide, Chris. So let's talk, right? Let's have a discussion, and we sort of have Chris and I have like a couple of questions that that we're gonna sort of throw open and see about. So um, what do you think influences a person's decision to bareback? And then what are some strategies for safer barebacking? So really the rest of our time together is just going to be a little bit of a conversation about these two questions. And hopefully the webinar format will allow us to allow you all to comment as well, but we'll see how it all rocks and rolls. So I'm going to turn it over to Chris and see what he has to say about some of this stuff.
Thanks, Kim. Yeah, so somebody noted earlier that because it's a webinar style, so unmuting and speaking isn't necessarily possible. So there is a chat. I think it is enabled. And so you're able to sort of um, pop your questions in the chat and ask directly, or make any statements that you like. But I think that, and I think we have somebody already. This chat says disabled, so let's allow anonymous questions. There we go. Should be available now. Yeah, so so I think you should be able to make comments now if you want to. So one of the, things when we explore why people bareback, one thing that we know is that since Canada and North America sort of adopted harm reduction policies, and there have been condom campaigns, and we have designed a condom for every single need based on size, based on color, based on shape, based on texture, based on all these things, whatever people might need to use condoms. And what we know is that the rates of condom use have not changed at all in 50 years. And so one of the things that we have to think about as service providers who are supporting the GBM community is what strategies can we give, because that's part of meeting people where they're at, which is core to harm reduction. So, like the condom preach is good, but how do we help people be safe, right, in the interim? And really, one of the reasons that a lot of people choose to bareback is simply it feels good. That's what they prefer. And in a lot of conversations I had with people, that was definitely something that came up over and over. For other people, it can be a really political, it can be a political thing. It can be a revolt against sort of a heteronormative homophobic thing that's happened. For others, it's about intimacy and connection. And so another reason is physiology. So a lot of people will indicate that they don't like to wear condoms because as soon as they do, they lose their erection. And then that takes them kind of out of the moment, and they're not able to maintain their sort of virility in the moment. And so, and when, Kim was mentioning a lot about condom rates, especially among people who are HIV positive. For a while, before we really had PrEP on the go, there were people who were so tired of living in fear about HIV and the pandemic and growing up with it, and just constantly having those messages, that in a lot of ways it was like, screw it. I have no fear. I'm doing this. There has been also some kink or fetish around what was called bug chasing, which is where people would want to have sex with somebody who's HIV positive, hoping that they could get it. And some studies have shown that the rationale behind it is about moving beyond fear, about really um, pushing back against it. So like the reason why people bareback are very, very varied. Like it's all very mixed. I know a lot of people also draw attention to the fact that there isn't the same campaign for heterosexual people, and that there has been this historical judgment on queer sex, and it has made it dirty and wrong, and that's been the sort of discourse that's happened. And so and so people are kind of pushing back against it, like it's okay for a man and a woman not to have a barrier, but I have to have a barrier because I'm gay. So there's sort of like a symbolic meaning attached to that, even though we know that there are higher rates among the GBM community for contracting HIV. The other piece too is that now with PrEP, pre-exposure prophylaxis, and just to like give you a breakdown, I'm HIV positive. I take a pill every single day, and because I take that pill every day, I live a relatively healthy life, normal life, and I cannot transmit HIV. And so that's really important to emphasize. And PrEP is the same pill that I take once a day for someone who's negative. And so with these combinations, like we've often talked about, one of the things that sort of started to really come out in the early 2000s was conversations about serodiscordant couples or magnetic couples, where someone is HIV positive and someone is HIV negative. And studies really started to spurt from there about rates of contraction of HIV among these couples. And that's where sort of the discovery about the fact that this medication prevents transmission. And so when PrEP came on the scene, it really started to really take root in Canada, a big jump in PrEP usage in 2017. And so we did see condom rates go down in 2017. And I know Kim had mentioned one statistic about HIV rates going up. I have one from the federal government that indicates that, in fact, in 2021, rates of new infections went down by 21%. And so it just depends on the stat we're looking at and how it's worded and what's going on with it. But there is a direct correlation between PrEP and condomless sex. Or barebacking, as we're talking about. And so because there's now no fear, if I take PrEP every day, I cannot contract HIV, because there's no longer that fear, people are engaging in it more, right? Because it's liberating, it's freeing, it feels really good, it feels better than wearing a condom. And so um, but we've also now seen syphilis rates go up, and we've seen rates of gonorrhea and chlamydia go up, and other STBBI. So one goes down and then the rest have gone up. And so there's a direct connection between that. So lots of different reasons why people choose to wear a condom or not. And sometimes there's no thought to it whatsoever, especially if you're out for the night and you're imbibing or something like that, and you're not necessarily planning for it. Another reason that we know statistically that people don't use condoms is that they haven't planned to, right? They don't have one with them, or the safety planning wasn't a part of, the sort of the package. So yeah, so we have a lot of different reasons why people don't use condoms, and we know that we continue to do condom education and different strategies for supporting people, but people will choose to do what people will choose to do. And so the question remains for us: how do we make barebacking safer? It's not that we're condoning it or condemning it. It's that we're saying we know this is happening. How do we support people to be safer? And so that's the question at hand. So I think, Kim, I don't know if you want to move on to the next piece about the strategies, the harm reduction based strategies. That'd be
Yeah.
great.
Yeah, sure. So if you want to go ahead and flip the slide, I'm just checking our time. And I also want to kind of throw one more actually, and I want to throw back at folks who are here, please chime in the chat. So we hear from you. If you have some thoughts about these two questions, why do folks engage in barebacking? Why aren't they using condoms? I think Chris really outlined that quite well. And there might be some other reasons. And then also, these things about strategies, right? So we've brainstormed some things. Chris has done so much amazing work on this, and then I've kind of like come in the back door a little bit. Oh gosh, that was not that I didn't intend that to be a pun. It was funny though. But so thinking about like HPV vaccine, hepatitis A or B vaccines, also engaging in this HIV prevention, so that we've been talking about TASP, PrEP, and PEP, and really having frequent testing, so that you kind of know your serostatus. Also limiting your sexual network, and douching frequently, right? It's just sort of like that. That these are just basic harm reduction things. Lubrication, one of the things that's come up a lot in research that I've been doing and that I've been hearing other trainings, is this notion of lubrication is so important to prevent mucous membrane tearing, right? Because when you have a tear or little abrasions, they could be microscopic, but there's still spaces that infection can get into your bloodstream, get into your body, right? So lubrication is super important for keeping everything, nice and gushy. And then obviously negotiating consent. This is something in Alberta that it's throughout Canada, this remains super problematic, but particularly in Alberta, because sex ed here is not fabulous. And so negotiating consent, lots of folks, most people, when you poll them, they don't even know what consent is. And there's not an understanding broadly of the fact that you even should negotiate consent. And so learning how to communicate with sexual partners, learning how to really get an enthusiastic yes is so important to preventing to harm reduction. And why negotiating consent matters is obviously, it's just respectful, not disrespectful. But also when you're not negotiating consent and you're sort of forcing the issue, and you're having the unsafe sexual intercourse of whatever sort, the risk of some sort of tearing or abrasion is super high. And then that goes back to this notion of lubrication, right? And also, when you negotiate consent, you can negotiate how you engage in sexual activity. So, will you use condoms? Are you all, what is your serostatus? What do you like? What do you not like? Right? Having those conversations really can just create whole sorts of lovely communication and really intimate sexual relations. And then all of a sudden, a lot of this stuff that I've just sort of said before it gets taken care of just by having negotiated consent and having those conversations that are really just about healthy communication. And this is not an easy thing to do. Most of us, I think, it doesn't come naturally to us because we're not really taught how to do it or even to think about it. Chris, what about you? Any other thoughts, or anybody want to sort of chime in the chat?
Somebody wrote, I heard somewhere that douching too much can harm the mucous membranes by drying them out by washing away too much mucus. Can you clarify? And can you talk more about douching as harm reduction strategy? So yes, it's true that there's some, is it flora or fauna? There are some things in your guts that are helping um, naturally in the body, and rinsing them out too often is not a good idea. I have consulted with an STI nurse and our outreach worker who does a lot of work with the GBM community, and the consensus seems to be about 3 times a week. Is kind of like a good max, but there are people who are doing it, multiple times a day or something like that, and that is too much, and it can absolutely, it takes away all of the things in the gut that that the body needs. But also, in terms of cleanliness and harm reduction pieces, like one of the things that we might think about are Shigella, or other things like that, like especially when we're talking about booty bumps, like if people are using substances and inserting substances into their anus to get high, having a clean area is also really important. And so that's one of the reasons why so that douching is important. I have heard and I have consulted with a nurse at the STI clinic about this statement that says that if you urinate immediately after sex, when you've had condomless sex, that it sort of stops an STI from sort of taking root within the urethra canal there. And and they looked into it, and the answer came back that it's commonly said, but we don't have actually scientific research to prove that that's true or not. But it couldn't hurt. I guess is the answer that came back. And just on the note of strategies for safer barebacking with folks, and on the note of the STI clinic, getting tested really regularly is a big part of harm reduction. Knowing your status is really, really powerful, because that'll inhibit obviously the spread of communicable viruses, diseases, all sorts of things, right? So regular testing is really important. Kim had mentioned different vaccines and medications. So the HPV vaccine, hepatitis A, B vaccine, and obviously TASP and PrEP, those things are really great. There's also an Mpox vaccine. Mpox was formerly known as monkeypox. It's not anymore. It's called Mpox. And it's undecided whether this is a sexually transmitted infection or it's transmitted sexually. And the nuance there is just like one is just physical touch, but because there has been a high content found within seminal fluids, that there's some debate as to whether it is an STI. Anyway, the point of that is that there's a vaccine for it, and when I did some research with the World Health Organization about um, um, why we were seeing a disproportionate rate of Mpox among the GBM community, the gay, bi, and men who have sex with men community, was because two things. One was regular testing. And even our own STI clinic, about 60% of the clientele they see are among the GBM community, maybe a little bit more. So the people in the GBM community are taking care of their health more. So obviously then these things are being caught more, because sometimes monkeypox doesn't necessarily present in a big way, like the little pox that presents. Sometimes there's just one little one. So it presents very differently for a lot of different people. But so regular testing is a big piece of that. And then the other reason about Mpox being so disproportionately represented in the GBM community is because of vast sexual networks. We in the GBM community have, we have sexual sociability, right? And sometimes there's a lot more freedom about sex. There's a lot more connection around sex that happens. And so one of the strategies for harm reduction is limiting that network. And we saw that during COVID when we talked about, what do they call it? Pods or something, whatever they called it, where you're just sort of limiting your network of friends, kind of thing. So, so, encouraging people to maybe have regular fuck buddies kind of thing instead of, vast. And that obviously doesn't work. And obviously we're not saying safe barebacking. We are intentionally saying safer barebacking, because it's not 100% safe at all, and we were not advancing it that way. But these are some strategies that definitely are important. And for lubrication, this is why we hand out lubrication along with all of our other harm reduction supplies at SafeLink. Another strategy is, I know I'm going a million miles a minute, but another strategy is, if you are a bottom receptive, you can wear a female condom. The female condom is typically inserted in the vagina, and it can be left in for 8 hours. And it can also be inserted into the anus with or without the ring. There's debate about what to do in it. And also can be left in. And so if you're a bottom who wants someone to wear a condom, but they don't want to, maybe they'll lose their erection if they put one on, or it takes them out of the heat of the moment, or they just don't like it. This is kind of a nice alternative because you're just ready to go kind of thing, and you can be in the moment, which is a really, really good strategy. We know that for people who are receptive or bottoms in sex, have kind of a higher risk of contracting HIV than necessarily top. Not huge, difference, but it is different. So we have trainings on fuller trainings on safer sex supplies, where we'll go fully into kind of what these things are and the workings of them. I don't have a female condom on me to demonstrate today, but that's certainly one thing. Safer substance use, where we do talk about booty bumping, which is something that's kind of gaining popularity among the GBM community in terms of sexual practice. So we have all kinds of trainings that will kind of go into these things, but these are just some strategies that we have been thinking about. I don't know, Kim, what do you think?
I was actually thinking one of the most fascinating trainings that I've attended in some years was the one that you did on chemsex, Chris. And I think you're calling it something different now. Is it Party and Play? Thank you. Yeah. And I know that you're going to be doing that one again. And so I really recommend folks that are here totally take Chris's Party and Play training, because in that training, he talks a little bit about all of these things, but particularly around this issue of negotiating consent, right? This can be super tricky when one is not sort of under using substances, right? And so when you are in a situation in which you're using substances and trying to have sex, are you able to negotiate consent in those spaces? And so I recommend that training. For me, that was like life-changing, in all honesty, to learn some of those harm reduction strategies in that circumstance and in those contexts. So I actually, Chris, if you flip my slide for me, the next slide is just some community resources. So these are right here. These websites are amazing. Obviously, SafeLink Alberta, this is where we are at the moment, and super important in our community here in Calgary. And then the Gay Men's Sexual Health Alliance in Toronto has an amazing resource page on sort of strategies for safer barebacking and safer sex practices generally. Also, the Queer and Trans Health Collective in Edmonton has some great harm reduction resources, and the Center for Sexuality here in Calgary. And so I really recommend, if you have like more questions, take some trainings that Chris offers here. And also these other resources are pretty amazing too, for just different knowledge bases and different strategies for how to keep yourself healthy and happy and safe as you go about your activities. Chris, is there anything happening in the chat or anything?
No, that's clear.
All right, cool.
So if you're interested in getting a copy of this presentation with the links and stuff like that, please email education@safelinkalberta.ca. Again, that's education@safelinkalberta.ca, and then we can send these to you. Yeah.
And so Chris has just flipped the slide to a survey that we'd really love for you to fill out. There's the web link there, but if you point your phone to the QR code, you'll get right to the survey. Super fast, super easy. It just lets us know how we did, know what else you might want to see in our Thirsty Survey, or Thirsty Thursday events, and also allows you to just, we'll change this if you didn't like something or did like something, we'll keep it, right? That kind of thing. But meantime, I'm just mindful of our time. We have about 2 minutes left. And so if you do have questions or things you want to add, or any comments or anything, please feel free to post them in the chat, and we will, and mostly I'll probably turn it over to Chris. But yeah, please feel free. These last 2 minutes are yours. And if we don't see you, please do feel free to fill out that survey. And then Chris and I will stick around just for a few minutes in case anybody wants to ask questions or debrief kind of offline. And I think Chris probably can go ahead and